Welcome to the Communication and Rett Syndrome webinar series, Course 1. I'm Andrea Etke, a speech-language pathologist and one of the moderators at the IRSF, International Rett Syndrome Foundation Communication Guidelines Hive. The Hive is an online forum for professionals who complete all 3 of these courses. The Hive is a private online forum led by experts in the field who provide ongoing mentorship, resources, and education about communication in Rett syndrome. In this webinar, you'll learn about the key features of Rett syndrome and how these features impact development of communication. You'll learn about the evidence-based communication guidelines in Rett syndrome, and you'll learn how to implement those guidelines to advance communication in Rett syndrome. This course is offered for 1 professional development hour, and at the conclusion of this course, you'll be able to take a quiz, and upon successful completion, you'll receive a certificate. Before we get started, I'd just like to give credit to Teresa Bartolotta, one of the co-authors of the guidelines and the original creator of this webinar series. Your learning objectives for Course 1 are as follows. First, we hope that you'll be able to describe the key features of Rett syndrome. 2, we hope that you'll be able to discuss how these key features of Rett syndrome impact communication development and expression. 3, that you'll be able to explain the process of development of the evidence-based consensus guidelines for communication in Rett syndrome, the handbook that we're talking about here. And 4, that you'll be able to list strategies to adapt environments to enable individuals with Rett syndrome to communicate to their maximum potential. Are you ready to get started? First, let's take a few minutes to describe Rett syndrome. So Rett syndrome is a neurodevelopmental disorder. Initially, Rett syndrome was recognized as occurring only in females, and it was hypothesized that Rett syndrome was actually lethal in males. So this suggested that Rett syndrome was a sex-linked genetic disorder with the gene being localized on the X chromosome. Since genetic testing has become available, though, there have been over 60 males reported with mutations on the MECP2 gene. Most males with mutations on that gene do present with an earlier onset of symptoms and typically with significant problems beginning at or shortly at birth. So the prevalence is approximately 1 in 10,000 live female births is how that's reported. The diagnosis of Rett syndrome is made clinically, which we will walk through in the next few slides. So through genetic testing, researchers have discovered that approximately 97% of individuals with Rett syndrome have a mutation on the MECP2 gene on the X chromosome that I just previously mentioned. So in addition to genetic testing being able to confirm that genetic mutation, we also see that Rett syndrome is observed clinically. So the hallmark characteristic of Rett syndrome is a period of normal development followed by regression in language and/or motor skills. So this first regression period typically occurs between ages 5 and 30 months and results in significant impairments in verbal and communication and motor skills. So as I previously mentioned, there are about 60 males reported with mutations on the MECP2 gene. A few of these males had a clinical picture consistent with the clinical criteria for Rett syndrome. However, most of these males presented with a different presentation when looked at further. So most males have that MECP2 gene present with an earlier onset of symptoms, with very significant problems occurring at or shortly after birth. So currently, any success of the treatment trials that are going on for girls with Rett syndrome are thought to be applicable to males with the MECP2 mutation. So any approved therapy for Rett syndrome could be considered for use with males with MECP2 mutations. In this training, I may say girls with Rett syndrome when I mean individuals with Rett syndrome, just to be inclusive and know that males and females can present with Rett syndrome. Also, the International Rett Syndrome Foundation is committed to continuing to fund research that will impact the quality of life for both boys and girls living with MECP2 mutations. So the diagnostic criteria for Rett syndrome is designated in the DSM-5. Previously, in the DSM-4, Rett syndrome was considered to be an autism spectrum disorder, but now we know that that is no longer the case. In 2010, the diagnostic criteria was revised and updated to reflect that Rett syndrome is made clinically, first through genetic testing to identify that mutation on the X chromosome. Second, confirmation is made through a blood test. And then clinically, we look at two types of Rett syndrome, either classic or atypical, also called variant Rett syndrome. So after a simple blood test confirms if a child has Rett syndrome, usually the pediatrician or a pediatric neurologist will use these criteria to make the diagnosis of Rett syndrome. To be diagnosed with classic or typical Rett syndrome, the individual must experience a period of typical development, followed by a period of regression, followed by a stabilizing period, plus these four main criteria that are outlined here on the slide. Partial or complete loss of functional hand use, partial or complete loss of spoken language abilities, impaired apraxic gait or the absence of ability to ambulate, and then 4, stereotypic repetitive non-functional hand movements. I would say the last criteria that I mentioned, the stereotypical repetitive hand movements, might be one of the most classic signs of Rett syndrome that we see with individuals that do a lot of hand wringing or hand motions or hands in the mouth. That's kind of like a classic sign that you may see. So all of these criteria are required that must be observed in order for an individual to receive the diagnosis of Rett syndrome. And so here's a list of supportive criteria that could assist with the diagnosis. Not all are needed to be present in order to receive the diagnosis, but these comorbidities assist medical professionals in identifying Rett syndrome. So you may see that the individual that you are working with or communicating with has respiratory disturbances. That might look like rapid breathing or periods of breath holding. You might see teeth grinding. You might see impaired sleep patterns or frequent sleeping during the day and then waking at night, abnormal muscle tone, peripheral vasomotor disturbances. This is a slow progressive circulation disorder, abbreviated as PVD, and it may affect the blood vessels outside of the heart, including the arteries, veins, or lymphatic vessels. So organs that are supplied by these vessels, like the brain and legs, may not be able to get enough blood flow for proper functioning, and it's most commonly seen in the legs and feet as being affected. You might see scoliosis or kyphosis. Scoliosis is a sideways curve of the spine, often taking the shape of the letter S or the letter C, whereas kyphosis is more of the hunching or slouching posture. We also look for growth retardation, meaning that the individual has stopped growing, small, cold hands and feet, episodes of laughing or crying that are not appropriate for the context, reduced response to pain, and then this is another classic hallmark sign of Rett syndrome, intense eye communication, often referred to as eye pointing. So we talked about classic Rett syndrome. Now let's briefly look at atypical Rett syndrome. In atypical cases, the child must experience a period of regression followed by a regaining of skill and must display a minimum of 2 of those 4 main criteria that we talked about, and then 5 of the 11 supportive criteria. And they're outlined here on this slide for a reminder. All right, so let's get into the communication guidelines. Prior to the development of these communication guidelines, researchers and those working with individuals with Rett syndrome recognized that there was limited literature on communication abilities of females with Rett syndrome. So what was there in the early literature suggested that they were severely impaired and incapable of communication. Few studies reported on communication interventions. All of them that did reported improvements in communication, so that was promising. For example, Scottco et al. In 2004 reported that splinting the girl's non-dominant elbow allowed her to access a single output switch to communicate. So small samples, small amounts of people in the studies, and these studies were also critiqued for their methodological issues, like not having a lot of follow-up or just not having enough participants to really show effect. So that's what was before. The other piece that literature has been reporting on is that most females with Rett syndrome are nonverbal or non-speaking. Thankfully, advances in AAC technology, augmentative alternative communication, and greater understandings of the abilities of individuals with severe disabilities now embrace a model of competence, which means that we can presume competence and believe that the individual is capable of learning, is capable of communicating. So the communication guidelines are an answer to this problem of limited literature. A small group of motivated professionals working in the field of Rett syndrome and communication joined together to devise this project. The purpose of the project was to develop clinical guidelines for management, assessment, and intervention of communication in Rett syndrome. This is in response to caregivers around the world continuing to report their struggles to access appropriate, knowledgeable, timely, and ongoing support tailored to the specific needs of people with Rett syndrome. And maybe that's even why you yourself are taking this course in the first place, right? You're working with an individual, or you know an individual with Rett syndrome, and you want to know more about how to help them communicate. The project was ultimately funded by the IRSF, and it led to the guidelines being published in 2020. Here's a copy of the cover of the guidelines, and if you don't already have a copy, you can order one at rettsyndrome.org, and there are hard copies and downloadable PDFs. So I encourage you to get one. These are members of the project team. You can see that it's an international team of researchers devoted to the advancement of communication abilities of individuals with Rett syndrome. So from the Netherlands, we have Jill Townend and Leopold Kerfs, and from Australia, we have Anna Urbanowitz, Helena Wanden joined from Sweden, and our very own Teresa Bartolotta in the US. The process of development for the guidelines was as follows. First, the team did a literature review to see what existing literature was out there. Then surveys were administered to parents and professionals. So 650 participants across 43 countries were surveyed. And a Delphi panel of 36 experts from across the globe reviewed draft statements and recommendations twice, providing feedback to the project team. The final set of statements and recommendations that reached consensus became the communication guidelines. This means that the guidelines are firmly based on findings from the available literature combined with expert opinions from professionals and caregivers around the world. So the guidelines are structured in the following order. First, you'll see the guiding principles, which give an overview of Rett syndrome as well as the guiding principles that we use when providing communication intervention and assessment. Then we talk about professional practice, features of Rett syndrome and the coexisting conditions, strategies to optimize engagement. That's where we're going to spend some time in this series. General communication assessment, AAC assessment, which will be covered in the second video of this series, assessment of the AAC system and device, and then intervention, which is covered in the third course of this series. So in this video, we're going to walk through sections 1, 2, 3, and 4. The guidelines follow a set of fundamental principles centered around the belief that all individuals with Rett syndrome have the right to be treated with respect, to have an appropriate communication system, and have the opportunity to make choices to be enabled to participate in society, have the rights to an education, and many other rights that are outlined in the United Nations Convention of the Rights of Persons with Disabilities. Within this belief, the guidelines explain that the potential to communicate is frequently underestimated in Rett syndrome. This is often due to the complex conditions that exist with Rett syndrome, right? We talked about a whole slew of comorbidities that you may see along with the regression of verbal skills. So it's important that communication partners have an open mind to the communication potentials of the individual with Rett syndrome. Third, there are no prerequisites needed for augmentative alternative communication. Everyone should be given opportunities to develop communication skills as far as possible. And, of course, individuals should be supported by a multidisciplinary team that includes a speech-language pathologist. The second section of the guidelines provides information regarding professional practice. So professionals who work with individuals with Rett syndrome should seek specialist knowledge and expertise in the area if they're inexperienced, just like you are doing right now by taking this course. Professionals should connect with other members of the broader team who are working with the individual and family so that support and advice and recommendations are coordinated. And then thirdly, the professionals have a responsibility to train other communication partners in communication techniques and strategies that will benefit the individual with Rett syndrome. For instance, you can provide easy-to-follow instructions or handouts. If you are the SLP working with a young girl with Rett syndrome and you know that she prefers a certain AAC system, then you're responsible for communicating that with other educators or service providers. So this slide features an image that is pulled directly from the guidelines. It's on page 17 of the section 3 of the guidelines. And it highlights the features of Rett syndrome and some coexisting conditions. Of course, not all individuals with Rett syndrome will present with all of these conditions, but an individual with Rett syndrome may have some of them. So dystonia means an altered muscle tone, dyspraxia or apraxia, that's a movement disorder. And that's when the person wants to make a movement disorder, but it's lining up all of those motor planning issues that kind of gets in the way and causes some halting or difficulty to map out that motor planning movement. The hand stereotypies, I'd say that one's the most common one that we've mentioned. It can look like hand wringing or hand clenching or hands in the mouth. Impaired oral motor problems are something that we see. Breathing and respiratory problems, so holding your breath, or her or him holding their breath, air gulping. Impaired sleep patterns for sure. Scoliosis or kyphosis, those are curvatures of the spine. Visual impairments are not one that we are going to look at in any of the video examples in this course, so I was just wanting to touch on them slightly. Individuals with Rett syndrome may suffer from impaired visual acuity, so maybe wearing glasses is something that's like an easy fix to help that individual be able to see, access the materials that are in front of them in their environment, etc. But cortical visual impairment, that's abbreviated CVI, is could occur in individuals with Rett syndrome. And that's a form of visual impairment that causes problems with the visual cortex and the pathway to the brain. So it's not a problem with the eye itself. It's that pathway from what the visual system is interpreting in the field around them and then how it's being processed by the brain. So this means that vision could be variable. Individuals with Rett syndrome that have CVI could have problems with depth or field of vision, trouble interpreting visual images or distinguishing images when there's a lot of visual clutter in the background. And this I've seen individuals with Rett syndrome that have CVI might also have a strong preference for red items or yellow items. And that just is another indicator that CVI might be present, something to know, something to keep your eyes open for. The individual with Rett might have hearing loss or auditory processing difficulties, difficulties with regulation, being over or understimulated, which we're going to talk about at length in a future slide. He or she might suffer from reduced alertness or fatigued or heightened anxiety, and even seizures. So keep all of these coexisting conditions in mind as we walk through the rest of the slides. We're going to look at video 1 and see what coexisting conditions that we can observe in the life of Josie. So the first video that we'll look at in this course is called A Week in the Life with Jovie, and this video is being shown with permission from the family. As you watch it, consider Jovie's hand and body movements, her ambulation status, her use of eye gaze, and think about her respiration, if you can catch that in the video. And think about how all of those coexisting conditions or difficulties may impact Jovie's ability to communicate with her family. Awesome. So what I recognized in this movie was that Jovie isn't able to ambulate, right? So her mom says we carry her up and down the stairs. And we see her seated in her chair ready for work. We see her eye gaze being used to communicate. When her mom sits down next to her, Jovie tilts her head back and then looks at her mom with her eyes. We see that when school starts, I think it's probably on Zoom, right? Because she's home. Jovie looks straight at the camera, looks straight with her eyes, kind of gives like a little smile to say hello. Mom shows us that she has yes and no cards, so we see some of that low-tech communication, and then she has a pod book, which has all kinds of vocabulary ready for her in there to use to communicate. So working with the body that she has, that Jovie's able to coordinate different movements and abilities to communicate in the setting that we see depicted here in this video. Oops, sorry. All right. So we just talked about a few of these that we saw in the video, but hand movements and repetitive movements and loss of fine motor skills, another hallmark feature of Rett syndrome, really impacts her ability to access objects in the environment, maybe even that pod book. Maybe Jovie's not able to turn the pages on her own and is reliant on her mom or other communication partners to turn those pages or select the yes and the no. It impacts her ability to access her AAC device. Dyspraxia or apraxia, difficulty or an inability to convert an intention into action. We see this in Rett syndrome often as needing extended wait time to respond. So a young girl that I've worked with for years, I just was reviewing a video that I had taken with her, and I asked her, "How are you feeling today?" And it took her, I think, 40 seconds to coordinate that movement to get to the page that she wanted to answer that she was feeling funny. But I had to give 40 seconds of wait time and wait patiently without interrupting or prompting her again to allow her body to work through the apraxia to give that answer. Another feature that we see that impacts communication is altered muscle tone. So that could be high tone or low tone, or dystonia, that's involuntary movements, which creates difficulty with positioning. It can create fatigue. It can cause an individual to feel locked in posture. Other key features are oral motor skills. So that could cause dysarthria, right? So difficulty with speech patterns, which makes it hard to produce oral speech sounds. Now, some girls with Rett syndrome or individuals do have preserved speech, which might be a single word, a couple words, or a couple of sentences, which would be a little bit more rare. Breathing and respiratory difficulties are common behaviors that we see, like breath holding, hyperventilating, air gulping, and all of that affects oral speech and her ability to execute a movement. The breathing and respiratory difficulties could also be a sign of increased anxiety, so something that you want to be aware of if you see that occurring, and see if you can manage that anxiety and help the individual work through that breath holding, like even just by saying, "Okay, it's time to breathe now," or just modeling a big exhale to help her move through that. And then third, scoliosis or kyphosis could impact the individual's ability to maintain proper head control or an upright position for communication. Seizures can reduce the opportunity for interaction or increase fatigue. So another little girl that I work with can have multiple seizures a day. And after that seizure, the brain has gone through so much that she is just so tired, and no communicating is happening for an extended period of time. And imagine if that happens multiple times a day or during a session. You can see how that would really reduce the opportunities for interaction. And for opportunities just to communicate or work on those communication skills. Fatigue or reduced alertness. Individuals with Rett syndrome might have fluctuating levels of alertness. She might be up and awake, fresh in the morning, and then kind of have like a lull in the, around lunchtime, and then perk back up, which just leaves them a little bit less aware of people, the environment, and less available for communication. I think this is good to know because it can help you if you're an educator or an SLP to plan those optimal times for engagement, or if you're a family member or a communication partner, just knowing that not all time is going to be, great times for communicating, that she may go in and out of alertness levels. And there's strategies for engagement and things that you can do as a communication partner to help her be more alert. And we'll talk about that in a few slides. Difficulties with sensory regulation. Individuals with Rett syndrome might have difficulty being underregulated or overregulated or over-responsive in their system. We'll look at we'll hold that thought for 2 more slides. And then mood and anxiety. I mentioned that she might have difficulties or trouble with anxiety or stress or kind of like being put on the spot. And if you can do something to reduce that anxiety inducing, environment, that could help impact her desire to communicate. Next, we're going to take a look at the second video in this course. As you're watching Michelle and her mom interact, look at Michelle's hand movements and pay attention to her communication acts and then how her mom responds to her. Think about the strategies that are being used as her mom, who's her communication partner, to engage with Michelle, and see what else you might notice.
Cookies. Cookies? Cookies. Food talk. It's cookies. Bye. Cookies. More cookies? More. More? Look how many? More. What's yum? Yum. That was yummy? That's yummy. Glad to hear that it's yummy. What else? More. Okay. More. All done. All done. All done. Okay. All done.
I like that video. So not all communication is so, clear cut and back and forth and easily interpretable. But I think that this video is a great example of how Michelle's mom kind of sits back and waits. And Michelle requests cookies and she's got it right there. Oh, cookies. I acknowledged. I heard what she said. She looks Michelle in the eyes. She's making eye contact and she gives her the cookie. She waits and then Michelle has that space and opportunity to say more, and mom responds, more cookies? Okay, here you go. Here's another bite. And then she sits back and waits, or she even makes a comment about it. And then Michelle says, yum. And mom's like, yum, I'm glad you thought that was yummy. And so she responds to Michelle's communication initiation. And so that's awesome. That's like keeping her engaged. That's using something that's preferred. That's a snack, whatever the cookie is that she likes, and giving Michelle time to coordinate what she wants to say. So that was awesome.
Cookies.
Again. Okay, so strategies for engagement. You'll see that Michelle's mom did these things, right? She addressed and talked directly to her daughter. She made eye contact. We didn't see Michelle in that video use multimodal communication, but what that means is you allowing the individual to use, a variety of communication strategies, facial expressions, gestures, speech, AAC, anything that the individual can use to communicate. If the communication partner is using multimodal communication, you're not only modeling that, but you're keeping that individual engaged. Remember that AAC is always available for any age. Make sure that the vocabulary and the topics that you're providing are appropriate to the interests of the individual with Rett syndrome, rather than just trying to match age appropriateness. There was a young adult that I worked with for many years, and she was 18, I think, or 19, and she loved Elmo and she loved Santa Claus. So I always knew that those characters would help her to remain engaged and keep good attention. No matter what we were doing, I knew that those characters would help her. Decreasing motor commands as cognitive load increases. This is a really good visual for thinking about the scales, like in a scale, right? So as cognitive mode gets heavier, then you want to reduce the motor demand. So because individuals with Rett syndrome have a challenging time coordinating motor movements, when you combine a motor and a cognitive demand at the same time, this can be very difficult. For example, you could use partner-assisted scanning when presenting her with a cognitively demanding question, like during an academic task. There's a young girl that I know down the street, and her mom was giving her, they're homeschooled, and her mom was giving her a spelling test, and I think it was a reading comprehension test, and which is hard, right? You're asking her to read the paragraphs and then stop and think about what she learned. And instead of asking her daughter to answer those reading comprehension questions, which have a cognitive demand, using her Jovie device, she used the ABCD on a dry erase board and let her daughter gaze at A, B, C, or D. So that's a high cognitive demand with a low motor demand. Maybe the individual needs assistance to be regulated. We'll talk about that on the next slide. Regulation level can either inhibit or enhance engagement. And then offering extended wait time. We saw that in the video 2, where Michelle's mom gives her a lot of wait time. And I even mentioned the young girl that I work with that needed like 40 seconds to coordinate her motor movements to answer a question. So silence can be tough. Waiting can be tough as the communication partner, but I encourage you to give it a try. So this image is pulled from the Communication Guidelines on page 29. This is figure 4. It's called the sensory regulation chart. And this is the traffic light system that was developed by Judy Riviere. And it's designed to help caregivers or communication partners to recognize the sensory arousal and needs of an individual with Rett, and to develop strategies needed to adjust those sensory needs. So it can help an individual with Rett syndrome to recognize their own internal state. So you can see like level 1 is green. That's perfectly regulated state. You're not too drowsy, you're not too overstimulated, you're ready to learn, you're ready to communicate, your body is calm, you feel supported and relaxed, you're sitting upright, remaining seated, you're established eye contact, smiling and giggling. I don't know why I'm saying you. This is the individual with Rett syndrome. You're seeing her interact, looking between different things, engaged, playing, having fun. She does not seem anxious or tired, and she's able to communicate with communication partners. That's that green traffic light. You are ready to go. Now, if you see the individual maybe being over-responsive or needing to be calmed down, that might look like she needs a sensory input or a sensory break. Maybe she needs a snack or a drink, or maybe she needs music to help her re-engage. Maybe you need to change the activity, or you need to get up and move around or change position. That could be level 2 or level 1, level 2 in either direction, I should say. Either over-responsive to the stimuli or under-responsive, need to be revved up or need to be calmed down. When the individual is in level 3, either overstimulated or understimulated, you need to recognize this to provide a strong sensory input, or maybe it's like a long break of taking a big long walk or moving around or providing input. Some of the girls that I've worked with need like deep pressure, a weighted blanket, a short clip of a show that she really likes or a song. But this looks like the individual is either like falling asleep and shutting down and is unable to communicate and participate, or is so agitated and so sensorily overload that just it's not a good regulated state. Just remember that each person with Rett syndrome is different. So what calms one person may agitate another. These are just general engagement strategies that we've gone over. So you'll just need to talk to the person and others who know them well and find out what works for them. Are the demands of a particular situation too high? Are you setting the demands too low? Asking questions and getting to know that person is going to help you to learn more about them and to create an atmosphere that is supportive yet challenging. All right, we're now made it to video 3. So this is a video of Annie, a young adult who enjoys horseback riding with her certified therapeutic riding instructor, Kim. You'll see in the video that Kim, as her communication partner, models language on Annie's device or on her laminated communication board that has activity-specific vocabulary related to horseback riding. So see if you can recognize those couple of things in the video. Note that Kim values communication acts using either modality that Annie gives, and she gives Annie adequate wait time. So all those things help her stay engaged. So keep engagement strategies in mind as we watch this video. Think about if you see the different modalities that Annie is using. Can you recognize how she's using her body? Can you watch Kim, the communication partner, and see what she does?
Are you getting frustrated?
Tell her what you want. Tell her what you want, Nan.
Do you want to walk? I know you're grabbing the reins. Can you tell Tuck that you want to walk? He can hear it. 2 feet. 2 feet. After riding, you can feed Tuck.
So Annie's smart, right? She Kim is giving her the iPad and saying, like, tell Tuck what you want him to do. And Annie's like, I don't need to use that right now. I can just pull up the reins, and he knows that I want to go, and you know that I want to go. And so Kim knows that, and she knows that, she acknowledges that. I know that you want to walk. I know that you have the reins. And she could have just taken that and gone and said, okay, you want to walk. But she is modeling communication on the iPad, and she is trying to enhance that skill for Annie. So she does kind of push her a little bit and say, okay, I know you want to walk. Tell me with the iPad. So that's a good way of a good example of engagement. She's using multiple modalities. She's responding to the communication acts that Annie is using. And I would say horseback riding is a very engaging strategy for communication, a very exciting activity, and it's one that Annie really enjoys and looks forward to. And so here I just wanted to, highlight that this is the paper version of her communication board that Kim always keeps hooked onto her horse's saddle, so that if they're, riding at a faster pace or moving along and Kim isn't able to hold the horse and the iPad at the same time, Annie has that paper communication board there to communicate. It also gives Kim a way to model that specific activity, specific vocabulary. So here's a quick video just to show the laminated communication board or low-tech AAC board that's clipped onto the horse's saddle in real time. So let's just see how Kim and Annie use that.
I want. You want to go outside? Can you show me again so I can make sure that's what we're doing? Outside. Very good. Very good. Maybe we can go. You want to go outside?
So I like that, how Kim takes the laminated communication board off, and Annie has selected I want, so she says it out loud, I want, and then She thinks that Annie pointed to outside, but she asks for clarification, and then Annie clearly points to outside. So Kim has said out loud and reinforced what Annie has said so that she verbalizes that she understands what Annie communicated. And she's just really keeping Annie engaged on this horse. She's asking her to make choices. What do you want to do next? And just keeping Annie communicating while still having fun. So I love that example. So we've reached the end of this course, of course 1 in this series. And what we covered so far is that individuals with Rett syndrome are capable of communication. We talked about the key features of Rett that impact communication. We talked about the fact that individuals with Rett syndrome should be approached from a perspective of competence and presuming that they are competent communicators and giving them opportunities to do so. We went over several sections of the communication guidelines that provide evidence-based suggestions for assessment, intervention, and management in communication for individuals with Rett syndrome. So now, since you've completed course 1 of the Communication Guidelines CE course, you should go here to this link for quiz 1. There's 10 questions, and once you have completed those 10 questions, you will get, with 80% accuracy, you'll get a certificate of completion. There's also additional program information at that link. We also encourage you to visit the International Rett Syndrome Foundation playlist on YouTube, on the YouTube channel, to access courses 2 and 3 of this series. There's the link there for you. And as I mentioned at the top of this video, once you've completed all 3 quizzes, we are inviting all speech-language pathologists or professionals that are working with individuals with Rett syndrome to join our peer-mentored, privacy-compliant online forum to foster real-time, real-world discussions and help you advance your work with individuals with Rett syndrome. So in this network, we share ideas, we brainstorm, we offer suggestions to one another. We've hosted several coffee chats, and they're each on a specific topic pertaining to communication and Rett syndrome. This network is available to you at no cost, so any professional that's completed all 3 courses in this series is welcome to join. So you just have 2 more to go. So great work, and thank you for taking the time to learn more about Rett syndrome. If you want to do some more reading, here are the references that were used and compiled in creating this course. Thank you for joining us.